A warm welcome to this talk. It's Wednesday the 24th of April. Now we're going to be looking at the use of midazolam in the United Kingdom. And it looks like a lot of people died as a direct result of being given midazolam. Now if this is the case, that means that COVID killed far fewer people than we thought, and midazolam killed way more people than we thought. This really couldn't be more serious. Let's hope there's not a massive scandal of international proportions about to break onto the scene. Now, let's give you the evidence for this rather than just me talking about it. Here we have this paper here. This is what we're going to be looking at. So the paper is entitled Excess Deaths in the United Kingdom, Midazolam and Euthanasia in the COVID-19 Pandemic. This is the link. Medical and Clinical Research. This is the journal. And just to give you the citation for this, is really important material. Midazolam and Euthanasia in the COVID-19 Pandemic, and it's published in Medical and Clinical Research, peer-reviewed journal article. Check it out for yourself. Now, what the authors did, macro data during the COVID-19 pandemic in the United Kingdom are shown to have significant data anomalies and inconsistencies with the existing explanations. This paper contends that the existing explanations of death, i.e. that a lot of people died from COVID, is simply wrong. People did die from COVID, but fewer than the official statistics are indicating, is the argument of this paper. England in 2020. In the UK, there was a spike in deaths. Now, I'm going to show you a few graphics in a minute, but I'll go through the text first. So, UK spike in deaths wrongly attributed to COVID-19 in April 2020. Wrongly attributed. This gave the impression that COVID was a much more dangerous disease than it actually was. And we based a lot of our thinking at the time on this inaccurate data that the government simply didn't correct for us. Let's just stick to what's in the paper. Wrongly attributed to COVID-19 in April 2020 was not due to SARS coronavirus 2 virus, according to this paper. These are direct quotes from the paper. Which was largely absent at that time, so the virus was largely absent, therefore it couldn't have been causing the deaths, but was due to the widespread use of midazolam injections, benzodiazepine sedative. Not only that, I know from talking to a lot of colleagues and some former students that it was often given with midazolam, which was the government guideline at the time. Morphine and midazolam given together will basically stop you breathing. This is not esoteric pharmacology. This is well known in healthcare provision, which were statistically very highly correlated, coefficient over 90%, with excess deaths in all regions of England during 2020, and as we'll see, all regions of the UK as well. Importantly, excess deaths remain elevated following mass vaccination in 2021. So this is arguing that excess deaths remained high following the rollout of the mass vaccination campaign, indicating that the mass vaccination campaign was nowhere near as effective as the government were indicating at the time, but was statistically uncorrelated to COVID injections. And when he says COVID injections, they mean, of course, the so-called vaccinations, while remaining significantly correlated to midazolam injections. So these excess deaths were not were statistically uncorrelated to the COVID vaccines, but remain significantly correlated to midazolam injections. The widespread and persistent use of midazolam in the UK suggests a possible policy of systemic euthanasia. Now, these are not my words. These are direct from the paper. You may think they're rather strong words, but we'll see it's based on very good graphical evidence that I'm about to give you. This really is a massive piece of news. Unlike Australia, where assessing the statistical impact of COVID injections on excess deaths was relatively straightforward, UK excess deaths were closely associated with the use of midazolam and other medical interventions such as morphine. And of course, we know that people that were ventilated didn't do very well as well. The UK iatrogenic pandemic. Iatrogenic means caused by medical treatment. So were these deaths largely caused by iatrogenesis? Certainly a lot of them were. Was it an iatrogenic pandemic as opposed to a COVID pandemic that was killing the majority of people? We must have answers to this. This couldn't be more important. We're talking about the lives of thousands of people. And I know from heartbreaking comments and discussions, many of those were relatives, friends, loved ones, family members. Caused by euthanasia deaths from midazolam and also likely caused by COVID injections, according to this paper. So the iatrogenic pandemic caused by medical treatment in the UK. 2 causes: euthanasia deaths from midazolam, according to this paper, and likely caused by COVID injections. What they call COVID injections. But their relative impacts are difficult to measure from the data due to the causal proximity of euthanasia. In other words, these things are happening at roughly the same time, so it's hard to pick apart what was the COVID injections and what was the midazolam injections. Both, of course, equally bad because the patient ended up no longer with us. Global investigation of COVID-19 epidemiology, based only on the relative impacts of COVID disease and vaccination, may be inaccurate due to the neglect of significant confounding factors in some countries. Let me know what countries the author is probably referring to here. Let's just look at a few graphics that illustrate this. So here we have UK monthly all-cause total deaths. Now the green here is monthly all-cause total deaths. That's in the green. And what we have in the red is the level of excess deaths. So we can see the excess deaths here and the total deaths there. No question about the excess deaths, of course, quite obvious. UK monthly excess deaths, baseline and sigma. Now the sigma here is the standard deviations. So basically, if something's 2 standard deviations, two sigma, that's counted as being significant in terms of statistics. If something is 5 sigma, that's 5 standard deviations away from the observation we would expect, the chances of that happening are 1 in 3.5 million. So 5 sigma is 1 chance in 3.5 million. And that you might remember that's how they worked out that the Higgs boson existed, because it reached the 5 sigma level of significance. So that's the standard used in physics. And of course, we're talking about life science here, which is, we often work on much, much lower levels of significance than 1 in 3.5 million. So they're the excess deaths there, and we see the monthly sigma. So there we see anything above, so that's the 2 line there. So anything above that line is significant. Anything above the 5 sigma line, which is about there, the chances of this happening are 1 in 3.5 million. So we can see that this probably reaches to here, and this most certainly does. In fact, this goes up to almost 19, nearly 20 sigma. Quite mind-blowing, really. Now, this is UK monthly new COVID cases. So new COVID cases here in green, and monthly new COVID deaths, all in thousands, of course. So what we're looking at here, so look at this line here. So this is the level of COVID here, and this is the level of deaths. Now, if this is accurate, this gives an infection fatality rate of 24.3%. And we know that COVID is nothing like as deadly as that. These people seem to be mostly dying, or correlates with the administration of midazolam. Again, monthly new COVID deaths in red here. And monthly new cases, relatively low. And here we see monthly new cases here, but monthly new COVID deaths being remarkably low. Infection fatality rate of only 0.18. So we see clear and strong correlations between excess deaths in 2020 and very low levels of COVID infections at the time when midazolam was being given out, with less caution than I would like to have seen. Now this is now the lead time here seems to be about 5 months. This is monthly COVID injections here, and this is the excess mortality. So if we take these two peaks here, so these are monthly COVID injections, and then 5 months later there's a peak in excess deaths, and again we can correlate the excess deaths with the COVID injections. Doesn't mean to say it's causal, of course, but this merits an answer. The correlations are accurate. And of course, very often, correlation is associated with causality. This is the prescriptions for midazolam according to openprescribing.net. So we see they peaked up. These are the different regions of England. So everywhere is giving out a lot of midazolam at this time, and again later on in 2021. UK monthly excess mortality by region. So we see that this was happening across the regions of the UK, is basically the point of that slide. UK, England monthly midazolam injections and deaths. Now here we see the midazolam injections in green, and we see the excess deaths in red, in thousands of course. So the lead time there, so we see that great increase in the amount of midazolam given in green, followed by the deaths very closely after that in red. We see it there very clearly. We see it here very clearly. The deaths slightly after the midazolam increase. Again, we see it here. Again, we see it here. But there is a very tight correlation. Now, of course, patients may be on midazolam for a few days before they stop breathing. So it's not surprising there's some delay. And prescriptions aren't always given straight away either. But that correlation there is very, very tight indeed. Remember, green is midazolam injections. Red is monthly excess deaths. If anyone says to you that those two peaks there are not worthy of investigation, how much tighter does it have to be worthy of investigation? They are very close indeed. This is for that was for England alone. This is for the UK as a whole. Again, midazolam injections in green. I mean, look how tight those correlations are. Midazolam injections in green, excess deaths in red. These are questions that need to be answered. Very tight correlations between midazolam use and excess deaths. That was the situation in London. Again, it's the same. The monthly midazolam injections and the excess deaths very closely correlated. That was the situation in Northwest. That's the situation in Southwest. That's the situation in England. And here we see the monthly excess deaths in thousands up there. Monthly new midazolam doses there in April 2020. I mean, wow, what a difference. This is where it kind of was before 2020 down there. But here we see very high excess deaths being correlated with excess midazolam use. So Not a proud day to be British, really. We need more studies on this, of course, but we also need answers, and this is something that mainstream media and government really should address as a matter of urgency. When I saw those correlations, I was reminded of the thalidomide, where we had the increase in thalidomide and, of course, the birth defects exactly 9 months later. An example where correlation did mean causality. Thank you for watching.